Really good to have you all here for the launch of the Global Society for Infectious Disease Dynamics. I'm Shweta Bansal. I'm based at Georgetown University in the US, and I'll be co-hosting today with my colleague James. Over to you,
And
James.
hi, I'm James McCaw from the University of Melbourne in Australia. It is 2 minutes past 3 in the morning for me, but I'm absolutely delighted to be here to contribute to hosting this session along with Shweta. And yeah, so do you want to just go to the next slide, I guess? So
Yeah.
I'll just briefly say what today is all about for the 100 people have now joined online, and of course we're running this session again in 12 hours at a more sane hour for me. But today there's really four aims for today. We're structured around the four goals of introducing the GSIDD's vision and purpose. We want to explore our community and identity, and then we want to gather your input and really continue that after the meeting, of course, as well, which is to gather perspectives, questions, and feedback. And then, yeah, ignite to really spark an ongoing engagement, collective action as we build towards what the society does as a proper, fully formed entity and existing into the future. So, just a little bit of an introduction before I hand back to Shweta to go through some more detail. But how did we get here? It's actually time flies. So it was in the Northern Hemisphere summer of 2024, I guess. I can't remember exactly what time of year it was, Shweta. You might remember. Um, that a bunch of people met rather spontaneously. It was August. Opportunistically while at a conference together, and you can see a list of the people who were either at that meeting or who have been working for the last couple of years, really, to come together to just say, we think that a society would be a great thing to develop, and now seems like the right time. And so we've worked through for a couple of years as a founding committee. I hope you recognise names down that list from people all around the world. We've worked through as a founding committee to develop proposals for a society. We've launched the website and all sorts of different things that have developed, and that's what's led us to today. So next slide.
And I'll just say some of the founding committee members are online with us
Yes,
today,
of
so I'll
course.
have them maybe turn on their camera for just a sec
Yeah, that's a
to
great idea.
wave.
Yeah.
Yeah.
Liz's wave zombie and Dennis is there. Yes, great. And everyone's been involved in putting together this event as well. So one of the first things that we discussed a lot and tried to work through were a mission and strategic goals, which helped us then guide the work we've done over the last year and a half or so. And what that resulted in so far is this statement of a mission, which is to promote collaboration, drive innovation, and advance education among professionals in infectious disease dynamics, and while actively advocating for the field's growth and impact on health policy and practice. And maybe we'll revise that as we go to form the society more formally, but it's a good starting point, and it has these goals to strengthen connections, build capacity, amplify impact, and make our field accessible and inclusive. What is hidden in there, of course, is that it's of infectious disease dynamics. And I think that's really at the center of why I think we're excited about this, is that it is now a meaningful phrase that many of us identify with, but of course it doesn't have a society. And so it's really the formation of that around something that we're starting to have a common understanding of. And so that's also about today, is continuing to build those connections and know what we want to do for ourselves as a group. And I think with that, I'm going to hand over to you, Shweta, and look forward to.
That's right.
Oh,
Yeah. Thanks, James. So you all might be wondering why we need a global professional society. You've carried on in your careers without one to date. So why do we need one today, particularly since there are so many other local and regional, even global organizations that already serve our community? This includes multi-institution collaboration networks and consortia, publicly funded community building initiatives, and even intergovernmental efforts such as the WHO Pandemic and Epidemic Intelligence Hub. So just say off the bat, right, the goal of GSID isn't to replace these existing orgs, but to be a connective tissue within the community by amplifying the great work that's being done by existing organizations, while also connecting individual researchers and practitioners across career stages and institution types that aren't even yet represented in any organization. Additionally, we think there are two key ways that we need to build on existing efforts. First, we need something that represents the multifaceted nature of our field, right? Some of us develop mathematical theory, others respond to outbreaks in real time. Some of us do, kind of focus deeply on specific pathogens. Others build methods that apply across diseases. And finally, some of us do basic science and others translate findings to policy. So what we need is an organization that embraces all of it and where we can all sort of learn from each other. Second, I think it's important for us to be independent and community-driven, especially in these crisis-laden and politically volatile times we find ourselves in. We should be able to have a collective scientific voice, advocate for our field on our own terms, and respond to community needs. We should also be by the community and for the community, which means not being subject to political constraints, funding pressures, or the priorities of any single institution or nation. And so to make all of this a reality, as James mentioned, there's been some work that's happened so far. So over the past year, the founding committee has done several things. One is we've launched the GSIDD website to share plans, gather feedback, and also start a resource hub. We've also started building our mailing list as a way to communicate with each other, and we're happy to say that this is now up to 550 signups. But really the most important step that we've carried out is a consultation process, both with existing IDD organizations, as mapped on the previous slide, who are already serving our community. But this has also included conversations with many of you as individuals at conferences and meetings. And all of this has really helped us understand that we as an IGT community believe we're ready to come together as a professional society. So all of this brings us to this event today, where it's a launch, but what we don't want to do is present something that's completed and decided and wrapped with a bow. What we rather want to do is just announce that this is something we believe we should all go forward with in earnest, so that all of us can now do this work together. And indeed, much work is required. So where do we go from here, right? So we think to make GSIDD real, we need to establish it as a formal legal entity, of course, but also have transparent governance and elected leadership, while simultaneously growing an engaged membership that reflects the full diversity of our field. But it's important to us to not do this work in isolation. So over the next 6 months, we'll be implementing some participatory mechanisms. First, we'll be asking for open community input on bylaws and membership structures and an equitable and enabling financial strategies, as well as committee priorities, all the scaffolding that goes behind a society. We'll also keep reaching out to organizations and individuals, especially those who we haven't had a chance to connect with yet. And we especially want to focus on early career researchers so that we make sure from the beginning that GSIDD is shaped by the next generation. So by late 2026, we're going to have a legally registered organization with elected leadership, transparent governance, and a membership structure. But between now and then, we don't want to just wait, right? We want to already be working for our community. So we'll be working with everyone to continue building membership, as well as that resource hub that I'll say more about later on. And also to build that connective tissue within our field, we're launching a monthly series that will be co-hosted with organizations from all over the world, and we'll say a bit more about this at the end. So that's the story so far, but much more of it needs to be written. So before I go on, I want to just pause here to let everyone gather their thoughts. And I'll also point you to, at this point, the Q&A box that you'll notice at the bottom of your Zoom screens. And I encourage you all to drop questions and thoughts in there as we go. We're going to try to take some time later on for those, and we'd love to hear from you. So next, I'd like to talk about our shared identity, right? So as we know, infectious disease dynamics is inherently interdisciplinary. This means many of us have spent our careers kind of spanning multiple fields without maybe fully belonging to any single one. We're also globally distributed across continents and contexts, which is a tremendous strength, but it can also make it hard for us to feel connected to others doing similar work. So this initiative is about creating a community where that interdisciplinary and global identity can be fully recognized and celebrated. Now, we all get asked, what is infectious disease dynamics, right? Most people didn't learn what this meant in primary school or earlier on in their education. So we often get asked this question. And when you're explaining this to folks outside the field, you might tell them, right, that IDD is the study of how human, plant, or animal infectious diseases spread or evolve over time and how they can be controlled. But as IDD research and practitioners ourselves, we know that there are many ways to be an infectious disease dynamics researcher or practitioner. And this can be in terms of the disciplines we're trained in, the scales and pathogens we focus on, and the applied areas our work translates to. So what we wanted to do is just take a minute to explore that and reflect on that, right? There's many facets to our identities as scientists, but our science is certainly at the core of that. So we have a bit of an interactive piece here where we'd like for you all to share what parts of the IDD field in terms of disciplines, scales, pathogens, translation you relate to. And so there's a survey set up. If you pull up the browser window or use your mobile device to go to menti.com and use the code 5179-6087, or you can use the QR code on your screens, and it'll give you a list of all of these options, and you can select as many as you'd like. We hope you don't select all 27. But if that's what your identity is, please do. And we'll look at the answers together in a moment. Yeah. Our identity, right? One of the hard parts in terms of like knowing who's part of our community is, not knowing its size and its composition, right? And being in the field that we are, I think we all understand how important it is to count. And so the GSIDD mailing list that so many of you have signed up for is allowing us to build a picture of the community. There are 550 signups so far, and these span all 6 continents, working across academia, government organizations, nonprofit organizations, industry, and it includes folks across career stages, all the way from students to senior researchers. And so this is all kind of giving us a sense of the community that's starting to form with GSIDD. And we're really excited about, seeing this diversity already emerging. But we also know that this isn't everyone, right? This doesn't represent anyone. There are regions and career stages and parts of our field that aren't fully represented here. And so building that will require help from all of you so that we can make sure that we're reaching everyone and hearing everyone's voice. In addition to kind of us as individuals, right, the other way, who we are is reflected is in the community organizations that bring us together. So as I mentioned, right, we've been connecting with this and building this landscape of IDD organizations from around the world. It was one of the first things we did as a committee, and this map, similar to the one that's on the GSIDD website, right, is a result of that survey. and learning about the many organizations that already exist has been really important to us. And if you haven't seen that list, you can check it out at the QR code on the corner of the slide. And so when you look at these organizations, you see our field's breadth, right? There's different scientific approaches, disease priorities, geographic context. And through the consultation process that over this past year with leaders from these organizations from all over the world, we learned not only about the gaps our community has and what GSIDD as a society could do, but also about the remarkable diversity of our community and the different strengths that each organization brings and the different aspects that they focus on. And so we wouldn't be as strong as we are today as a field if it wasn't for the effort of these existing organizations and existing efforts around the world. So again, we hope to connect with them, amplify them, and fill the spaces in between rather than do anything like this. And so lastly, in addition to sort of community organizations, part of our identity is also about what we share and how we support each other. One of the things we've been excited to start is a resource hub. And this is on the GSIDD website. Again, you can go to the QR code to reach it. And it's sort of bringing together seminars and trainings and job opportunities from across the field. To be clear, we're not creating these resources from scratch, but really just starting by collecting what the community already offers and making it more accessible. And as with many other things, right, there's much more work to be done on this. There's a lot of great resources out there. So we really look to help from everybody to strengthen this hub. I also want to make sure to draw your attention to the DEI resources. This has been a more recent topic of conversation in our field. And really strengthening our fields means ensuring that diverse voices and perspectives can fully participate in research and practice in IGD. And so this collection of resources kind of highlights recent efforts to raise awareness of inequities and then also promote equity in our field, sort of highlight efforts that are allowing us to do that. And we hope this will inspire action towards a more inclusive field.
Thanks, Greta.
Over to you, James.
Yeah, thank you. And I just think it's really exciting being reminded and seeing some of those connections and the maps because and thinking back to we didn't see all of the Mentimeter results, but that the idea that we can bring together, we have some societies which are or some organizations which cover maybe the globe, but then are only on one particular element of infectious diseases, say human public health, and then we might have another group that's spans sort of the technical areas of IDD, but it's only in one country. And I think this is an opportunity to bring those, fill in all of the gaps, as you've said. So I'm going to talk a little bit about more about input. And you can jump to the next slide, which is has more detail than, well, actually, maybe hopefully you can see it on the screen, but we won't go through it all in detail. But through the community surveys that were conducted last year, we've asked you and your colleagues, because there's many more than who are online today, what value GSIDD, and I seem to say it out as the letters at the moment, what value our society could bring. And we're still working through these responses. This is a wonderful first pass at looking at trying to structure things that members of the founding committee have done. And so this is one way of looking at things. So, and we're going to put this up on the website probably as a blog post over the next few days or week or so that everyone can sort of look into it a little bit more and reflect on it, because you might have other things to add. But at a high level, what we have told ourselves, or you have told us, I don't know how to say that yet, is sorts of structures out around 6 really key ideas about what the society could really support us with. So there's knowledge exchange, research impact, career growth, networking, resource sharing, and advocacy. And just as an example, because I'm not going to read all of the individual ones, but under knowledge exchange, you might notice that there is mentoring listed there. And this could become, for example, a focus of a subcommittee of the society. So as we come to develop the formal structures of the society, it may be that we choose collectively to set up a subcommittee or a group that's responsible or has a mission to provide a global connected mentoring system that could help people, and then we'd set up the resources and the infrastructure underneath it. That's just a possibility. At the bottom right of the screen under advocacy, I'm going to say a little bit more on that one.
Sorry.
That's fine. You will see it's the top small black one. It says unified voice and visibility of IDD. And I think this is a really important one, and it's sort of been a theme through what we've been talking about today. But it could be that we prepare statements posted on, say, our website, or to be delivered to organizations or governments, or even peer-reviewed papers co-authored by members that provide a perspective from our community. This could be anywhere from a statement on the GSIDD website about what we believe the role of modelling in understanding some biological process. We could submit that to like a funding body which was reviewing its terms of reference to advocate for the sort of techniques of mathematical modelling as being an important aspect of scientific discovery. Or it could be an opinion piece that we submitted to the WHO talking about best practice in modelling transparency or something for public health decision making. So these are all, again, just examples of things that having a society could enable us to do under a suitable and to be developed kind of formal organisational structure. And there's many more things in here. Eagle-eyed, some of you may notice comments under research impact about journals and conferences and things, which are certainly ideas that we will explore in due course as the society becomes an established and sustainable entity. Next slide, I think, please. So the other way that we've been able to break down the responses and the input that we've received to date is by looking at the career stages of the people who are providing the input. And so this is a graphic that again we'll be able to share through the GSIDD website through a blog post. And what you can see is that so different people at different career stages who are all part of our growing community have both different needs but also different potential contributions to give to the society and different interests in terms of resources. And so what I'd like to just point out, and this is a wonderful starting point for us to build from, is that many of the needs that you might identify, let's say generally at a more junior level, are actually things which are being offered as key contributions from people who are maybe a little bit more senior, who are seeing and recognizing that they could offer. So it's wonderful. We've seen a description example for a need for training or perspective and mentoring, but we've also had offers of mentorship and best practices from established researchers. So our job will then be to make the most of those opportunities of identified needs and generous offers of support. So that's exciting and says that I think we've got the foundations for a wonderfully supportive and enabling community. So we just a little bit of a pause summary, and we wanted to get to this point. I think it's past, and we're right on the dot. So please keep providing feedback at the moment directly to our website. This is where we're monitoring the inputs here. So that's info@gsidd.org. We're going to, and please keep adding questions to the Q&A, and we will be working and going through those soon. And yeah, we're about to jump to some more Menti questions. And Shweta, you're obviously running this. Are you confident that we'll be able to, things will work?
Yeah, so I'm gonna exit out of this for a sec and then try something different.
Yeah.
Um, okay, so back to you, James.
Yeah. So everyone, you can go to menti.com and there's the code 5179607. It's the same as the one before. So there's three questions about to come up, and it's there on the screen. So they're kind of phrased in slightly different ways. So, but what's one thing that would help you feel more connected to others in IDD?
We'll hide the responses for a second so that everyone has a chance to ponder and respond, and then we'll reveal them so that we can all start to see what others are thinking.
You'll be able to scroll back and forwards when you set up.
Bring some of those up.
Okay. And so this is hopefully just, you know, right now in the moment, interesting and valuable for, you know, other people on the website, on the webinar to read. It will also, you know, be useful information for us to look through afterwards, to get a feeling for how we, you know, focus our efforts in terms of shaping the formal structures of the committee, because you know, things will, you know, we have, of course, like any organization, we'll have limited resources and opportunities, and so we'll have to, you know, prioritize things. But it's wonderful to see this.
Exactly. Yeah. Thank you all for your great ideas. I think it's safe to say, right, there's no shortage of good ideas in our
Yeah,
field.
that's right.
And especially on this point of connection, right, there's definitely a need for this. And so lots of great ideas coming up. But you know, prioritizing, as James said, right, will be a key part of this because practically, right, it won't be possible for us to, even as a society, with everyone chipping in, do everything all at once.
Yeah.
And so this can, you know, prioritizing itself can be something we open up to the community and get feedback on. So we're definitely thinking of ways of participation in those ways as well.
Yeah. And yeah, but there's all sorts of, I've just seen a Slack workspace, which is a practical suggestion of many other comments that have come earlier about ways to connect and communicate, and provide that space. And these are the sorts of things we've been thinking about. We see there's lots of comments about, you know, conferences or support for movement. And like other professional societies, obviously it takes time, but if they have the financial resources or they build them up over time, they have student travel support schemes and all sorts of things. These are all things that a society over time, you know, can do, and that can be enabling and exciting for communities. So yeah, this is wonderful.
All right, so I'll move us to the next one.
Yeah, let's move on to the next question, which is, you you know, oh, where are we? Oh, people already answered the question. I'm confused. What is this? Oh, did we have people been able to answer the next question? I'm confused.
Yeah, I think this might have happened earlier.
Oh,
I think we
great.
see
Okay.
so, yeah, yeah. There's only a few answers, so let's hear from everyone else as well.
Yeah, right. Okay. Yeah. So oh, I understand why. So yeah, the next question is what resource would most empower early career researchers in in our field, IDD dynamics. So that's my it's 3 o'clock in the morning stutter. So please answer this question, and we'll see what comes through. So I think broadly expressed in sometimes in slightly different ways, where we're picking up similar sorts of things. Okay.
And we see a reflection here of course, right, early career researchers that are on the call, answering from their own perspectives, and mentors answering from a different perspective, maybe in things in terms of training. So I think it's great to see the different perspectives.
And that financial support for research visits. Yeah. This is an interesting one. This peer review of funding applications, I think, is a very interesting idea. And this
as
is
we've
also,
said, many. Oh, please, sorry, go ahead, James.
No, you go.
I was just going to say, many of us are part of, other professional organizations where, many of these activities are implemented. So if you find other good ideas from other organizations, please bring them up.
Yeah, and then the idea is we bring them together for our community.
Mm-hmm.
Higher salaries.
Higher salaries, yes, indeed.
That would be good. But I mean, I think what this maps through to is one of the things I alluded to perhaps before on an earlier slide, which is because obviously a community-led organization, isn't an employer, but it is an opportunity to write strong, clear pieces to bodies, perhaps funding agencies, to explain the value and importance of our field in various other areas of, say, science or public policy, which, if that's an effective advocacy activity of the society, it could map to better employment or more opportunities for people who are starting out in our society. So I think there are things like that we may be able to make a difference on this would be over time, but it would be through these indirect pathways.
And implementing these, right, that work will happen through the committees. So please, if you have good ideas and willingness and energy to help implement some of these things, please consider doing that later.
Okay, I think we'll jump to the last question.
Right, perfect.
Thank you for your input. So the last question is, it's got a preface at the start, which is many of us have found homes in other disciplines, which is wonderful. And I'm a member of the Society for Mathematical Biology, the Public Health Association of Australia, my applied mathematics community in Australia and New Zealand. I'm not going to leave those because I'm helping or being excited to be part of this community that I'm also lucky enough to help establish as part of the founding committee. I'm not going to leave those other communities, but I'm excited that I can also in the future say I am a member of GSIDD. So that's the little blurb, but what will it mean to you to have that community built specifically around infectious disease dynamics. So this is a feeling question, not a we need a something question. You can enter up to a few different words. While we're all watching the magic of network minimization algorithm in real time, like tension thing, I'd encourage you please we're about to jump to the Q&A, keep adding here. So your questions, keep putting them in, and we'll start going through them shortly.
It's so important to see, right? The support and recognition aspects show up here.
Yeah, which are sort of in and out versions of.
Yeah, I mean, right. And recognition, right, is it's such a central part to career progression in science. And when you're part of an interdisciplinary field, that while that's very exciting in so many ways, right, the recognition aspect can be challenging, right? Always having to explain what you do and that it is in fact a real area of studies, right? That's a really important piece here. I'm glad to see connection show up, right? That's been a theme sort of throughout. So great to see that coming up as well.
Great. Okay.
Excellent. Thank you all so much. Yeah.
Thank you. So yeah, we've got about 17 minutes left on the webinar. We've got a few slides to come at the very end, but really now we'd like to have some time for you to open any questions, and the way this is managed with the webinar, it would have been lovely to have lots of videos on, but it was a little bit hard to know that we could safely manage that with numbers. So you have to type your questions in the Q&A. If you haven't found it, quite a few people have. Yes, it's on the bottom row. You might need to click the More button. There are no open questions at the moment, so we can't answer any. So
there's a couple that were answered by other members of the Band-Aid committee that are on the call, and we can certainly start by talking about those as others.
Yeah, so please, over to you, because I haven't seen them yet.
Okay, great. Yeah, so there was a question brought up about kind of, is there an opportunity to translate media content into a few languages for those of us who don't understand English comfortably? And that's an excellent point. And I think since being inclusive is a key part of the strategic values and goals for GSIDD, right? That is a really important piece of the inclusivity puzzle. So we will certainly kind of be looking into this, especially for contexts where we're producing materials that are in the future once the society is established, and as a result of that committee work, right, when we're producing things that are meant to be shared broadly, then certainly having it available in multiple languages would be an important piece. So please, keep those ideas coming, and if that's something you are willing to help out with, then please let us know.
Yeah. Great. We now do have
James,
some
it looks like there's more questions
open.
Yes.
Yeah, so I'm happy to just say something about the top one. So there's a question about are we using sort of another society or organizational model that's sort of serving as an unofficial template for how it builds? And broadly, yes, we've looked at a number of societies like Society for Mathematical Biology and some other local ones that people of the founding committee happen to be members of, to look at their governance structures and boards structures, and by and large, we're modelling these around the idea of a society which is, a community-led type of society. So, we'd expect that we would have, and we'll share some draft bylaws very shortly for people to look at, but that would have, a small executive committee. It would have annual elections or biannual elections, say, and it would operate that way. This is very much related to the question, how will the society be funded? In the end, the society will be funded by its members. So we will establish an equitable and enabling subscription fee. So the details of that are exactly what needs to happen between now and later this year when we establish it as a formal legal entity. And it will be a group that people will hopefully choose to join. And yes, that will cost some money. Exactly how much is precisely the discussions that we will want to have, and to figure out something that is enabling so that we can do some of the things that you can see there's appetite for, but that's equitable so that our funding model reflects our values and our goals. About the monthly seminar series, Shweta, you might want to say something about that in the next section. So we'll say something about that soon.
Yes.
Just one more thing on funding before I hand over to you to answer some other questions. It will, of course, take time to become financially sustainable because we will be starting from zero, of course, or almost zero. There's been a very small amount of money kindly put in by a few of us through grants and other things that we have. And we will, if some other organisation with financial was interested in supporting us under appropriate conditions, there may be some opportunity to get some funding, but primarily it will be built up by our community for our community. I might hand to you, I think.
Okay, sure, yeah. And chime in at any point. So John Drake, thanks for your question. John asks, what is your plan for communications, either monthly or quarterly bulletin, an internet newsletter, or a blog? And so that's a great question, John. Right at the moment, our goal has just been to kind of broadcast, the proposals that we're putting together. And so the key mechanisms at the moment for communication are going to be the website and the mailing list. That's how we're reaching out to people. And we'll be sharing, for example, the sort of open commenting periods for the documents that the founding committee will draft, things like the bylaws or the membership fee structure that James was mentioning, right? So we'll release all of those things through the mailing list. So again, a reminder to sign up for anyone who hasn't done so yet. But going forward, right, once we're established, certainly communications are going to need to be a key part of the society's function. And I could imagine a committee dedicated specifically to that sort of sends out bulletins or newsletters on a regular basis. But in the meantime, right, certainly the website with the blog, keeping the blog updated is something we've been trying to do and reaching people over the mailing list.
Yeah, and I think this is related to another question or a few other ones further down. Ed Hill, for example, has got one, and there's some questions in between we'll come back to. At the moment, the way that the communications have been focused around is learning what the society should focus on and what it should look like. And so at the moment, there is one committee, it's the founding committee, and its task is to establish the society. So it doesn't have multiple subcommittees it's just a small group of people who are collecting all this information to establish something. And so upon the establishment, that will be our responsibility, is how I see it, is to ensure that the underlying bylaws and governance structure to start with is compatible with what the mission and goal of the society is. And from there, decisions would be made by that committee, which may have some people overlap, but it may be, you know, we'd hope that we'll have new people coming in from, you know, this group, larger group here, onto that to then say, right, under the frameworks that have been established, we should set up an engagement committee that will have a newsletter. We should set up a financial sustainability or committee that will focus on building the support that will in the future enable us to have travel support funds. Or so the structure and the size and the scope of the committee is the next step, because at the moment we must build that solid foundational starting point from which everything and the sort of richer activities can develop. So, you know, and that extension, the blog at the moment is to help with that engagement process, the communication mechanisms once the society fully exists. You know, I would hope will be richer and more diverse, and more people will, you know, be driving them. There's a question. Yeah, go on, please.
So I was just going to reiterate for folks, especially anyone who joined late, right? We don't want to present something that is, you know, complete and fully functional and active, and that's quite intentional, right? We want this to essentially be the starting line so that the entire community can be part of shaping what this looks like. This is why we've kind of created the 6-month delay in the process, where today the idea is just to announce that we'd like to go through with this because we've gathered enough feedback at this point to see that there's agreement on going forward. But the details of that, right, really there's a chance for everyone to shape what that'll look like. And then of course for us to revise that as we go as a community.
Yeah. And further on, there's a question from Luke Coffing at it's the last question. There's still some to come back to further up, but yeah, the draft framework for governance and bylaws is something that will be put out for open feedback. It was one of the slides right back near the start. Shweta mentioned that, so that they will be there, and yet the way the precise way in which a society is formed, it's tied up to the legality of, and I don't think we should, it depends upon what jurisdiction somewhere on the planet that we form something, but yeah, what would typically happen, because it will be tied to the regulatory, the regulations of the jurisdiction, is that there would be an inaugural meeting where there would be a formal vote on these, that yes, we're adopting this set of this constitution and bylaws. So that is what will happen later this year. And the next 6 months is to get to a point where we believe, with feedback on what those bylaws and governance structures look like, the aim is so that when that meeting occurs later this year, the people who join the call, who you know, endorse and agree to that being the bylaws, and at that point, once it goes in as paperwork to some, you know, and some bureaucrat somewhere signs something, the society will exist. There is a question back up a bit about how GSIDD will be different from existing IDD organisations. And I think this is what we've been trying to work through. When it's not to replace anything, but it is, we hope, different in that it is community by members and for members, and that it's comprehensive. So it's not tied to one. It's not about, say, human public health, or only human public health, or only biosecurity, or it's not about applied mathematics identity in biology, or it's not only about one scale, it might be about, and it's not only about say within host biology or something. It's that IDD covers all of these different angles. So disciplines, methodologies, fundamental science through to translational policy relevant science. And then at least we don't believe that there's any organization that has that breadth of connection. And so that's why we think the society is right to set up.
All right, so there's great additional questions coming in. Please keep those coming, folks. What we'll do is for any questions that didn't get answered, but including the ones that did get answered, we'll try to add a sort of fact to the website so that you can come back to those for questions. There'll be a comment option on that, so you can leave additional thoughts. But we'll move on to the next section here and wrap this up. But please keep the great ideas and thoughts and questions coming. All right. So for this last bit, yeah, we'd like to just kind of sum up, right? So we believe we have a chance to really build something great together. And from our perspective, there's kind of three key goals, right? Of course, we can do a million different things, but three key goals. So one is connecting our community, kind of bringing together diverse researchers across disciplines and regions and career stages who've been working in parallel, but not always in conversation. Second, building resources on sort of more on the practical side, kind of making knowledge and tools and opportunities openly accessible, whether you're at a well-resourced institution or you're just entering the field. And lastly, to create belonging, right? So finally, kind of having an inclusive professional home built for infectious disease dynamics where our interdisciplinary and global identity doesn't need explanation. But all of this is only possible if we're, kind of in this together and can kind of get support from everyone. And so here's what you can do right now, right? So to build with community building, right? Help us build that mailing list, get the word out to colleagues who may not have heard yet. We know there's a lot of colleagues that we haven't yet heard from. If you know about org's initiative and initiatives that we're missing on the IDD.org landscape on the website, please share that and help us build that resource hub, right? If you know of trainings and seminars and diversity and inclusion efforts that should be included, send them our way. We've got a lot of great feedback already about the resource hub. And so it'll be great to kind of really build that and strengthen that over time, even over these next few months while we sort of really explicitly establish ourselves as a society. Secondly, we need everyone to contribute to that infrastructure building around the society so that we can ensure that this is our society collectively, right? So again, as we've mentioned a few times, we'll have an open community feedback process for all the documents that kind of go behind a society: bylaws, membership structures, committee charters, and really just a chance for you to keep giving input. There's also ways you can do that on the website, so please keep talking to us. Lastly, I want to highlight and announce the IDD Connect series. This is that monthly series I mentioned earlier. This will be starting in late March. It's going to be a series where IDD organizations from different regions of the world will showcase their work, share their perspectives on the landscape, and help us kind of collectively explore what we should accomplish together as a society. So we are really grateful to the organizations that have already signed up. The next one will be highlighting, the first one rather, will be highlighting Oceania, then we'll move to the African region, and then back over to the Asian region in a few months' time. We'll continue this till we make our way around the world. So please keep an eye out for announcements about that via the mailing list and the website. And thank you all so much for joining today. We are really excited for what we can accomplish together, and Really appreciate you all joining us to kind of celebrate the beginning and for everything you're going to contribute to make it real.